Hi, I'm Moksha, a second year MBBS student, and today we'll talk about the genetic disorders. Now, genetic disorders can be classified into three types: the single gene defect, chromosomal defect, and multifactorial inheritance. Now, single gene defect is of two types: Mendelian disorders and non-Mendelian disorders. Now, Mendelian disorders is further classified into X-linked recessive, X-linked dominant, autosomal dominant, and autosomal recessive. Today we'll talk about the autosomal dominant disorders. Now, as the word suggests, autosomal dominant, which means autosomes are affected. Now, male is equally affected as females. The basic pathology is there is the defect in the structural gene, example collagen, elastin, fibrillin. Now, one thing which you need to know is that the homozygous dominant state is incompatible with life. It can be expressed in the heterozygous state. If it is a homozygous dominant, then patient cannot survive. Now, the age of presentation is generally adulthood, 20 to 30 years. Skip generation is usually absent, which means every generation has at least one person with the disorders. And it also shows the property of incomplete penetrance, which means the clinical manifestation is not seen every time because of the heterozygous state. Now let's look upon the pedigree analysis of the autosomal dominant disorders. First thing you can look for is the male is equally affected as females, as you can see in the pedigree. Second thing is skip generation, which is absent. Now you can see in the every generation there is at least one person which has the disorder. Now that's how you can identify the pedigree of the autosomal dominant disorders. I hope you like this video, so don't forget to follow me for the next part.